Namaskar and welcome to Dr. Ivy's. Today I talk about a medicine called Minoxidil. Now, the policy on my channel is that I do not discuss pharmaceutical grade products or medicines or what we doctors called drugs. But for this video, I have made a little exception. The reasons are twofold. Firstly, my very dearest friend CC requested for some information on minoxidil, and therefore this video is dedicated to you, CC. I hope you're watching. The second reason is that minoxidil is sold for hair loss, is sold as an over-the-counter medicine or product in European nations, in the US, in Australia. Surprisingly, in India, minoxidil is a Schedule H drug. That means it can only be sold on the prescription of a registered medical practitioner and by a registered pharmacist. But of course, as you know, minoxidil is available, in your friendly neighborhood pharmacy, and it is also available on Amazon. So it really doesn't matter that much. Now, before we actually go into the video, there is a very important clarification that I want to make. Irrespective of whether minoxidil is an over the counter medicine or an OTC medicine in the Western world, this video is only for those people who have been prescribed minoxidil for their hair loss by a doctor, your GP or your dermatologist. Sometimes what happens, your dermatologist or your GP is so busy she doesn't have time to answer all your 10,001 queries on a particular medicine, in this case minoxidil, or you think of the medicine of the question when you have already left her clinic. So this video is for these kind of doubts, and I aim to increase your knowledge base of minoxidil in case you have been prescribed it. But if you have landed up on this video on my channel because you have been experiencing some kind of hair loss and you are planning to self-medicate yourself with minoxidil without a doctor's prescription, then my dear viewer, this video is not for you. You can go to other. In fact, I think you should go to your doctor instead of starting off with minoxidil. Now, minoxidil, and I'm going to refer to this medicine as Minoxi now, sounds a little bit like Minakshi. So, Minoxi is an old player in the pharmaceutical world. It's been here since the 1970s when it was being used as treatment to lower very high blood pressures not responding to conventional treatment. And vigilant doctors noted how use of this minoxidil resulted in their patients sprouting hair on their bald heads and a general overgrowth of hair all over the body. And then they did a lot of research on minoxidil in its topical form, that is, in a lotion form for hair loss. And that is how minoxidil entered the market, and it's been there for a long time and has established itself as a treatment for particular types of hair loss in men and women. So, what does Minoxi actually treat? Well, you know that Minoxi is used for hair loss, but please remember that it is used only for two specific types of hair loss. First is the male pattern baldness, or what we doctors call androgenetic alopecia. That is, the males in their early 40s, sometimes late 30s or mid 40s, they start going bald from in the vertex or in the crown, or they have receding hairlines. So that is called male pattern hair loss or male pattern baldness or androgenetic alopecia. Women also experience a type of alopecia or hair loss called FPHL, that is female pattern hair loss. So Minoxi is effective for only these two types of hair loss. Now, of course, doctors also use it off-label for another type of hair loss called telogen effluvium, which is very common, or chronic telogen effluvium or CTE. But the problem is that this minoxidil that is used for CTE is mostly in the oral form, that is tablets. And secondly, the results have not been very definitely proved in research, but still it is used off label. And therefore, I reiterate once again, please do not self diagnose yourself with any kind of hair loss without consulting a doctor, and please do not self medicate with minoxidil. Now, you would probably be wondering that is minoxidil effective? So if you have been prescribed minoxidil for the specific type of conditions that I just mentioned, then with consistent use, you will definitely find that there is an improvement in hair count, hair texture, hair length, and you will also find noticeably that hair shedding is decreased. Therefore, it is definitely effective. Now, minoxidil is available in three forms: the 2 or 5% minoxidil solution or liquid form, the 5% foam, and finally as a spray. Now, you would be wondering which is the best formulation for you. If you have been prescribed the medicine by your doctor, then obviously she would have told you which formulation to use. But nevertheless, as a general guideline, if you have long hair, that is, if you're usually in women because they have long hair, it's easier to use the liquid, because the liquid then, the foam actually gets tangled in your hair strands and does not reach the place where it is supposed to reach, that is the scalp. So it's better to use the liquid. However, if you are allergic to any of the components of the liquid, that is either the alcohol or sometimes it is formulated with propylene glycol, which helps the medicine to penetrate into the scalp. If you're allergic to either of these two, which are found in the liquid, then please shift to the foam. Now, if you are a male with short hair, then you would find it more convenient to use the foam because it gives you greater control. The foam is also better if you've got lesser area to cover. Similarly, for the hairspray, if you have the minoxidil spray, if you have a smaller area to cover and you have short hair, then use the spray or the foam, which gives you greater control. We now come to the question of how you should use it. The first thing to remember is that the medicine is for the scalp skin. It is not for your hair. And therefore, when you're applying it, make sure that you're applying it to the skin of your head, that is the scalp, and not the hair. Second, your head and your hair should be absolutely dry before you apply it. Thirdly, please make sure that you don't have any active cuts, wounds, abrasions on your scalp, because that would lead to chances of greater allergies. Now, how do you apply it? The requisite amount, obviously, your doctor would have told you how much to use, but generally, what we prescribe is one. That's Mimi, that's Iris. Okay, so what we recommend is 1 ml. So you take the 1 ml in a dropper. If you're using a liquid, it comes with a dropper, so you pick that much 1 ml of medicine into the dropper, part your hair and apply it. Once you've applied it, you can gently massage it to cover the entire area where you are bald or you are thinning. As for the foam, what you do is pump the requisite number of times, as is written on the label or prescribed by a doctor, onto the cap of the bottle, and then dip your fingers into the cap. Take the medicine on your fingers and gently apply it wherever you're supposed to, that is, wherever you have thinning or baldness. Please remember, don't use the foam or the liquid like sarson ka tel and rub it between your palms, especially the foam, because what happens is when you rub it, the medicine is formulated in such a way is that when the heat of the body touches it, it becomes active. Now, if you rub it between your palms, the heat generated will turn the medicine active and your skin of the palm will absorb it. So by the time it reaches your head, nothing will be left. So for foam, do not rub it between your palms. Now, the amount. As I said before, 1 ml for the liquid, and read the label of the foam where it tells you how many pumps would be equivalent to 1 ml. So take that amount of that many pumps into the cap and then apply it. Now, as for the next question, which I know would be in your mind, and that is the percentage of the formulation. Remember that the best percentage of product for men is 5%, and for women it is 2%. Please don't be tempted to use higher concentrations. Why? That is because, first of all, no real visible effects have been seen when you use a higher concentration. And secondly, when you use higher concentrations, there's something called the phenomena of tolerance that comes into being. So that means tolerance means that your body gets used to the product, and therefore it requires greater and greater and greater amounts of medicine to become effective. And therefore, please, for God's sake, do not get tempted by the you have 7.5%, you have 12%, you even have 15% of product percent formulation of minoxidil. Do not be tempted by these higher concentrations. Stick to 2% if you are a woman and 5% if you're a man, and I'm very sure you will get excellent results. Now, how long should the medicine be on your scalp? You would require, say, 30 to 40 minutes for it to be on the higher side. I know that's on the higher side, but that would be, I think, a decent amount of time that you can give the product to penetrate your scalp. So wait for 30 to 40 minutes before you lie down, before you wear a cap, before you exercise. Why? Because you would be sweating. Before you do these things, wait for 30 to 40 minutes. So I personally feel that the best time would be to apply it when just before you've had your dinner, before if you're going to have your dinner. And once you have your dinner, I think 30-40 minutes would have passed, and then you can go to bed. Now we talk about the side effects that you might encounter. Now, before that, I just want to tell you that please do not use minoxidil if you are going to have a baby. The safety in lactation is also not very well established. So, if you're feeding your baby, try to avoid using minoxidil. And of course, don't use it on an inflamed skin. Now, we come to the side effects. You see, it is an OTC drug, that is, it is an over the counter medicine, and therefore, you the logical conclusion would be that it is very safe. Yes, it is a very, very safe medicine if used in the concentrations that I've just told you. Now, the commonest side effect is something which we call irritant contact dermatitis, which is basically an allergic reaction. Your scalp becomes red, inflamed, itchy, dry. So, if you're facing any of these problems, you could be either allergic to minoxidil itself, or more likely you're allergic to the vehicle, that is either the alcohol or more likely to the propylene glycol, which we just talked about a little while ago. And in such cases, please meet your doctor. She will be able to tell you what is it that you're actually allergic to. Now, there is another important side effect, that is if you're careless with the product. If you're using a product which has got a greater concentration, say you've got tempted and you're using 7.5% or 15%, or you're allowing the minoxidil liquid to drip down your face, then especially in women, you would see unwanted hair growth over your face, around the hairline, in your forehead, and the sideburns area. So please be very careful. Make sure that you're applying minoxidil only to the place where it is meant to be applied, that is your scalp. And don't get tempted by higher strength formulae. Now, since it is actually a blood pressure medicine, a lot of queries come to us about, will it cause my BP to become low, or will it give me palpitations, or it will give me weight gain. So most of uh, these these side effects are something that is more like a placebo effect. This is because the patient is convinced that because minoxi is a blood pressure medicine, so it will cause these kind of side effects. Actually, in research, the penetration of minoxidil that is applied on the skin into the bloodstream is very, very, very minimal. And therefore, it's a very safe drug, and definitely you will not get low BP or palpitations or weight gain with minoxidil that you're applying topically or on the skin. These kind of effects are seen with the oral preparations, and uh, except for, as I said before, very a very unresponsive kind of a female pattern hair loss or unresponsive androgenetic alopecia or baldness. Only then people use, the doctors and that also dermatologists use oral minoxi. So don't worry, if you're using topical minoxi, you will not get any of these heart related issues. Now let us talk about certain things which maybe your dermat didn't have time to explain to you. So I will talk about those things. The first, please remember, when you start using minoxidil, for the first 1 to 2 months you might see an increased shedding. So don't be alarmed. It means that the drug or the medicine is acting. It is effective. So just remain patient and carry on. The second thing is that remember that it takes 4 to 6 months of consistent, regular use before you see results. You will not see results before 4 to 6 months. Therefore, as I said before, patience is the key. डटे रहना, अच्छे दिन पक्का आएंगे. The third thing is that after stopping minoxidil, after around 3 to 4 months of stopping minoxidil, you will lose all the hair that you gained. That's the sad truth, and nothing can be done about it. I have already mentioned the phenomena of tolerance. So, the tolerance will come one day. So, the way to delay tolerance is by not exceeding the 2 and 5% that we talked about. Don't get greedy. The another thing that we tell our patients is that, after maybe 6 months you can shift to alternate day application. There's one more thing, especially for gentlemen. The ideal candidate for minoxidil is a person who has got thinning at the top of his head. We call it vertex. If you have something, that phenomena of receding hairlines, minoxidil is not very, very effective for receding hairlines. And last piece of advice is that please, please do not self diagnose yourself with any of the diseases that I've just told you, AGA or FPHN, that is female pattern hair loss. Leave it to your doctor, because she knows. She knows best. She studied for 8.5, 9 years, and she's got so much of experience. So, leave it to her wisdom to diagnose you as a candidate for minoxidil. Don't waste your time and money and efforts by self medicating. Yes, if you've been diagnosed and if you've been prescribed minoxidil, then do see my video, share it with your friends, and you know have a head full of healthy hair. So till my next video, namaskar. Bye bye.